Okay, so welcome to Maternal. I am Kenya Gibson, and I am really honored and blessed and fortunate to have Tatyana Ali joining us for Maternal today. We were just talking a little bit earlier about motherhood and all these things that are intertwined, and a little bit how we met, right? So you and I connected at the Mama Glow Doula Expo probably about a year ago, and I was sitting there in the room and I was listening to your story, and I was like, oh my God, like I had no idea. So I kind of wanted to start there with that because I know you're known for all these other things, but I don't know if a lot of people know that you do a lot of work that's very important in the Black maternal health space. So I wanted to kind of tap into your story.
Yeah, I think my story, where does it start? It kind of starts with community. I was going through kind of breaking generational curses and just wanting to nurse my first baby, my first son. I wanted to nurse him and nurse, hopefully exclusively. I know, I didn't know what how that would happen or what my body would do, but that was my goal. And up until 2 years old, and the women in my family, at least for the generations that we can remember, hadn't done that. And I was really seeking community, so I I posted, a little bit about just I don't know. I can't even remember what I posted, but it was a lengthy text where I talked about, you know, aunties who were like, "You still breastfeeding that baby?" Just like a different it just kind of bringing a culture change in my own family and the journey that I'd gone through. And then because of that post, I was asked to attend a panel, to be on a panel for the Black Mamas Matter Alliance. And when that invitation came, by the time I was there on that stage in Atlanta, I was pregnant with my second son and terrified because of the actual experience that I had giving birth to my first son, which I'd never shared. And
Mm,
I was looking for another way. I didn't want to, you know, our both our lives were put at risk unnecessarily. I had a very healthy pregnancy, kind of normal, everything was steady and everything just, went completely downhill the moment we stepped into the hospital. From coercion into an epidural, from um, at one point, they held me down. Um, People I didn't know in the room screaming at me. Um, it was extremely harrowing, and it all resulted in me asking for a C-section because I thought they were going to hurt him. He was
wow.
crowned for a very long time, and and they wouldn't let me move. Um, and forcibly, physically, I experienced obstetric violence. It's not until doing this work that I even had the name for what we experienced in the room. And once I did that panel at Black Mamas Matter Alliance, this is 4 years ago. My youngest baby is 4 now. Um, I was pregnant, not showing, didn't tell anybody, but I found myself in the middle of in this room with 300 or so black black and brown midwives and doulas, and just going, "Oh, my prayers have been answered. God put me in this room."
Mm,
And I hadn't even shared my story yet. And I didn't share my story until I did all of the research I needed to do for me and my family to be able to figure out, what is this? There must be another way. What is this
right.
other way? And all I wanted to do when I found out that information was to share it so that we all know it. Because if I had known then that this reproductive justice community exists, that these incredible advocates and birth workers are working, they know what the answers are and how to
Hmm.
take care of us properly with kindness, with love, respecting our autonomy. I just wanted to share it. And so the first thing I
Yeah.
did was um, I wrote an op-ed in Essence called Birthright, and I've been doing that work ever since. And I just don't want any family. I don't want any of us to ever have to experience what my husband and I went through. We don't deserve it, and there's so much there's better for us.
Yeah, for sure. It's interesting when you were sharing certain details about your experience, it makes you verklempt because I'm like, God, like I can't even imagine, right? Like I had a traumatic experience with my son, but at the same time, like even the term obstetrics violence, right? That's kind of really the first time I've heard that be brought up on the podcast because a lot of the
Mm.
times we're talking about the statistics about how Black women are 3 times more likely to die, right, from childbirth complications over our counterparts. But like we haven't had a lot of stories where those experiences beyond the statistics have come to the fruition. So I commend you for taking such a painful process and being able to turn that around to really be able to educate women on how they can advocate and speak up for themselves because that's kind of a tough place and a tough situation to pivot from.
It is, and there's a lot of trauma involved, like physical and emotional, and the strain that it takes on the family. I am so grateful that, my son is healthy and well. He was in the NICU for 4 days after because of the trauma of his birth. That's actually
Mm,
why. Um and because of what happened in that what they did. And we made it through with our lives. And what I learned very early on sharing my story was that my story is not rare. The story is not rare.
mm,
So many people have experiences, and through the generations, I even sharing my story allowed my elders in my family, my mother, my aunts, my they started to tell me what happened to them, things that they did not voice for all these years. And yeah, it's been going on too long. When we think about how we should be cared for, how we should be treated, nobody should be yelling at you.
right,
It's your
right.
body.
It is.
This thing that, like, somebody else is taking our babies out of, it's my body. The baby
Mhm,
has to come through me. So there's a spiritual quality to becoming a mother and giving birth. However it happens, because everybody's situation is different. And
mhm,
I could tell you a little bit about my second birth afterwards, just to kind of illuminate that point. Babies come how they come. That's true.
mhm.
We can't control that. But how we're treated, how we're cared for, whether or not we're listened to and respected, it actually impacts our outcomes.
For sure.
Those things, those small moments,
Mhm.
they impact those numbers. That's why the
For
numbers are the
definitely,
way
and I would
they
say
are,
for us,
because
I
our
think, yeah, culturally, we've learned how to teach ourselves to endure, right? And that's just historic, right? I think it started with slavery and it's continued through the times in our lineage, and we've just been in a place where mindset wise we're like we're strong and we've learned how to endure and we've learned how to process pain, and it's like we've normalized that for ourselves, and like that's not okay, right? And I was going to ask you, as you were going through this process, like what was your mental health like? Because it's like that's so much trauma to your body, to your mind, to your spirit. Like, was there anything that you needed to do to like cultivate that inner healing? Because that's a lot.
Yeah. Luckily I have my husband's a professor. He's a professor of English, and so he's very communicative. That's part of his nature, his spirit. And so we talked a lot. We talked a lot. We cried a lot. We walked through it together. Therapy. I have my therapist in my phone.
Mhm.
um, physical, physical healing, kind of yoga, exercise, and it's a process. It's a process that I'm still in. That I'm still in. Also, for me, and I know everybody's different. Sharing my story has been a part of the healing process, and if I were to look back, which I would never do, but if I were to look back at different conversations I've had, public conversations, about my story, where I'm telling my story, I can see the stages of, I can see grief, I can see anger. I see the,
Yeah.
it's kind of, I could track it if I went back, but it's and also what I'm where I'm at now is recognizing and embodying the fact that we're safe now, because we were in a situation where we were not safe in a hospital.
Mhm. Yeah. Where you
In a
think it's the
hospital
safest place. And you
where they're
would think,
supposed to be there.
because
Yes,
yeah, you would think, I mean, everyone knows about, your career and your accolades, and you're an actress and all these wonderful things. What I'm finding about our situation with Black maternal health is it doesn't discriminate amongst us as Black women, right? It doesn't matter our socioeconomic status. It
it
doesn't
doesn't.
matter where we are career-wise. It doesn't, like, we are treated across the board in a way where those things don't factor in when we're having these type of experiences, which is why we're having these conversations, because I think that that's part of the way to break down these barriers. Like, it doesn't matter what I look like, sis. It doesn't matter who you think I am or what I do. It's like, this is a universal problem amongst us, right? And the only way that we're going to get past that is if we join forces together and we start to share our journeys, and how we can teach one another to speak up.
I think, and this is why I really um, gravitate towards the reproductive justice framework. There's what it's done. This issue in particular, this our struggle, is it's exposed a lot of stuff.
Hmm.
When you look at the data and you see that the things that in our society that are supposed to matter, right? How educated are you? How
Right.
much money do you make? Where do
Hmm.
you live? All the things that are supposed to matter, which, think about it, why should that matter?
Right.
Why should those things matter? Does that make me a person more deserving than someone who doesn't have those things? Why let's you break that down. Why should that
Hmm.
even matter?
Right.
There's that. But when you look at all that data, because those things don't matter, you know that it's one thing that's affecting it, and it's race.
Hmm.
It's
Right.
racism. It's bias. And
Hmm.
you can't graduate your way out of that. You can't make enough money to get out of that. That is the way it is. So it's a real kind of, to fix things. Yes, you're right. We have to be in community. We really have to be in community with ourselves, and not buy the I have so much money, so I'm better than you logic that has been really, running our country and the world.
Hmm. Hmm.
Being a human being should be enough.
For sure. And not being judged based on the color of your skin or what someone perceives of you, right?
Mhm.
I wanted to bring it back to the education piece, because you're very well educated. You went to Harvard.
Mhm.
I had saw. And so,
Yeah.
in terms of like looking at it from an education standpoint, like, how do you feel like implicit bias training like comes into the fold? Do you think it's an effective model? And like, where would you say that would be best implemented when you're looking towards like kind of retraining the way society thinks towards this? It's like an epidemic, you know?
I'm excited by the efforts that are being made. I'm always, if you look on my Instagram, I made a jingle for the Momnibus bill because one of the pieces of legislation is implicit bias training, is a way to even interact with hospitals and medical spaces so that we can be honest about what we're experiencing, what those experiences are. And I think it's important because implicit bias is a big word, but what it really means is, or it's a term that people like to throw around, but to get to what it really means is, when you look at me, what do you see? What assumptions are you making about
Mhm.
me? Do you think that I can't express myself? Do you think I'm a liar? Do you think I'm on drugs? Do you think I don't care about my baby? What are you
All those
those are
things.
all these are all the biases that come into play when we go into spaces. And those biases are unacceptable. They're unacceptable to somebody who has taken on the profession to care for the health of people.
Yeah. So you've testified in front of Congress, right? Like about a lot of these issues. And what was that like? How did that feel? And how do you prepare for something like that?
It was during the pandemic, so it was virtual. And I have to be honest with you, it was a little disheartening. It was disheartening because there were brilliant Black doctors. Charles Johnson, he lost his wife
Hmm.
in the hospital at Cedar Sinai. He was there. He's been very vocal. Brilliant doctors. And I found that the conversation degraded into whether or not racism exists. That's my
Interesting.
personal take. And that I'm
Mm.
giving you the real like that's and they
Yeah.
asked you for a little questionnaire afterwards after your experience, and I shared my experience I did my questionnaire like the little dork that I am. I was like, this is what I thought happened. It really
Hmm.
degraded it into and and it's very split, you know. Congress is very split, as we all know. And it degraded into, but those are those people.
Mm.
We know that that happens to those people. How could this happen to you? There was a lot of disbelief and a lot of, yeah, just the question like, but this can't be because of racism, because racism is not real. It was interesting. It was
That
interesting.
is
And it was
very
also hard.
interesting. I was gonna say, I mean, you talk for a living, but I don't know if I could ever get up in front of Congress and really. Well, you know what? I can't say that. I
It was
think
on my computer.
well, that part too, but I think because, you're so closely connected to the cause and like you have such a personal attachment to it, right? Like it doesn't make it easy, but it allows you to be, passionate about it, right? And
Mhm.
unfortunately, I'm so sad that that didn't translate in the way that you hoped it had, and that I think sometimes people find excuses to, acknowledge the truth because it's easier to entertain the lie, right? Or the
Mhm.
false narrative that's there. So sometimes, you get that with people, which is nothing we can control, right? We can only share what's factual, what we've experienced, what's going on, and we hope that people take that information and are willing to do something with it.
Yeah, and I do think, even though my experience there was even though I said it was um the even though I said the reception, that I was disappointed in the way that the
Mhm.
conversation went, I I am still and was, even at that point, optimistic because, you know, I'm a praying person, and the Bible says the way is narrow.
Amen. Yeah.
So I don't I don't need I need us to know. Like,
Yeah.
I need us to know. And I
Mhm.
need us, like your show, Maternal. I need us to create the connections, to create the pipelines, to create the resources, to create the community. That's what I need. And
Mhm.
the way that the country works, even March of Dimes, I need that's what I need. I
Mhm.
want to see us empowered. I don't need I know, and this is anyway, that's how I feel, at least now. That is
Right.
what's important. And the ears that need to hear, hear.
Mhm. Yeah,
Because
definitely.
sometimes, there's some ears that I'm like, I don't know, maybe you're too old. I can't.
Right. Or it's, you know what? I feel sometimes too, we're sowing seeds, right? And
Yeah.
sometimes we don't see the harvest of that right away, or the fruit of that. We may never see the fruit or the harvest in our own natural space, right? But we don't know, like, spiritually, what that exchange was on the back end. So, I say all that to say, like, you can't discredit the opportunities that come up where God uses you to speak and advocate for this and stand up, because you never know where that seed might end up down the line.
For example, and this is like a kind of a spotlight example, but when I started talking about this 4 years ago, we were talking about the statistics, we're talking about everything that was going wrong. And that, but now 4 years later, Abby Phillips did that wonderful, that amazing special where she's talking about why, as a Black woman, she made a different choice. Why she, so because the ears that needed to hear heard. And that's what it's about. That's
Yeah,
what, when you talk about advocating for ourselves, I sometimes, when people first started using those terms, I was like, it's really hard to advocate for yourself when you're in labor.
it is.
That's very hard, but you can advocate for yourself all the way. Who,
Leading up to that.
that's right.
Yeah, and we
Who
were
are you
we were talking
choosing?
about that earlier, even from picking the right provider, finding out who,
That's right.
I didn't even I think when I went to my first OBGYN, it was just something I went and I did because I was supposed to do it, but like I never thought about the process of picking a provider until I had a bad experience with my son and then yeah, and then that I had my daughter and I was like, wow, I get to choose like
That's
somebody
right.
who I have a connection with and I could potentially pick somebody who looks like me, right? Who's probably going to understand me a little bit better and empathize because we have that in common, right? So I totally get what you're saying about the preparation that's leading up to that because it's all those little things that lead to what the experience in the birthing room is like, right? And you
Exactly.
can only control the controllables, but at the end of the day, it makes a huge difference.
That's right. That's right.
Yeah. Yeah. So I wanted to talk about March of Dimes because I'm so excited that you all have partnered and you're doing things. So what exactly are you doing as part of your partnership with them?
Well, I've been a part of the celebrity council for a while, um, but now doing more work and really getting into it with them, and I really getting into a partnership with them. Getting into it, I was like, that has other. Sometimes that has other meaning, but no, really getting into partnership with them. I'm really interested in um, working on maternal care deserts, places in our country where people have to travel very far to get the help that they need. We all know like this is a really critical time where reproductive services are being slashed all over the country. And um, there's a report on maternal care deserts that's going to be coming out soon. And so I'm excited to help amplify that report, the findings. Um,
Mhm.
Also, I hope what's also in that report is ways to mitigate that. Um, so yeah, that's the work I've been doing with them. And my mother always worked with the March of Dimes. And so even when I was very little, when I was doing Fresh Prince, I used to do the march when I go back home in Long Island with my mom
Yeah.
for many
That's
years.
great.
Yeah.
They're a great organization. I mean, I first off, I appreciate them for seeing the vision in this platform. And one of the things that I admire about them is statistically, they are so on point with everything that they're doing. And one of the things that I felt was really important to this platform was credibility, right? Which is why, as
Mm,
a partner, they've been phenomenal because you mentioned the maternal health, health desert reporting that they do. I mean, they really from a data standpoint, track everything that's going on. And then you have the report card where you can actually look at how things are moving statistically, where things need to improve, and even when you're talking about the maternal health deserts, like the mobile bus, right, that is going to be able to go out now into these areas. I mean, and it's not the full solve, but like, wow, what a solution to be able to
yeah.
bring these into communities where women are driving over maybe 40 miles to have a baby or to get to an appointment or to have adequate health care. So I love that they've been very purposeful in their data and their approach to solving what's going on with the Black maternal health crisis. Because sometimes I think, it's we can talk about it, talk about it, talk about it, right? But it's nice to see an organization that really has their self together where you see the impact, you see the data, you see where things are moving, and it's measurable, right? Which was super important
Yes.
for us as a partnership. So I love that you're aligned with them because they've been phenomenal to work with and have been just great partners of ours.
Yeah, they're amazing. Actually taking action on the ground where people feel it.
Yeah.
People are actually affected by the work that they're doing.
Mhm.
Yeah,
And to see it data-wise, because I'll be honest with you, I had not seen a ton of reporting statistically until I started working with them, and I'm like, "Wow, like, this is pretty impressive that you get to really see where these, disparities are affected more in what areas." I mean, just down to the zip code, like, where the needs are. So I think just empirically, it's important to have that type of data to just, have it as a resource because it helps us move the needle and it helps show us where we need to put the work in. So I'm excited
right.
about that. So anything that you've been working on recently in this space that you're excited about or that you want to talk about or share?
Yes, I am. Something that I am going to be sharing very soon during Black Maternal Health Week. I I sew, and it's something that I've kind of kept to myself, but I've been
Wow.
doing it. Yeah, I've been doing it for a while, and um, especially when I was pregnant, I was sewing up a storm. While I was on this journey, when I was pregnant with Alejandro, I um, I did a lot of work with groups who would give me, they would give me like a basket, like a gift basket, but they would put it in Ankara fabrics. And it happened a few times. And I had all this fabric, and it meant so much to me, especially because I was pregnant at the time that I was doing a lot of this work and investigating and finding out. And I decided to make a blanket for my son.
Hmm.
And my husband and I put our wishes in it for him. And um, it's a quilt. And over the years, I've gotten so many compliments because we wore this blanket out. Okay. It was a stroller blanket. I used to swaddle him in it. I would put it on, when I'd wrap him,
It
that would
must
go
mean so
over
much
the
to him
wrap.
too. Yeah.
Yeah. I'd wrap him in it, to keep him warm. And it's such a happy blanket. It's something that I've wanted to do and wanted to share. And a lot of these groups that I work with, especially midwives and doulas who their dream is to start a birth center, to work in places that are maternal care deserts, the places where
Mhm.
we need them the most. Um, they need money. They
Yeah.
need money.
Mhm.
And so I'm starting with my first series of 50 blankets. They're called baby yams,
Aw.
and they're heirloom quality. I don't sew as fast as what I needed for this. So a wonderful woman in Los Angeles is helping me sew them and get them out. The pattern is called the abundance blanket.
Oh,
That's
I
the
love
wish.
that. Yeah.
And it's a way for us to come into community and to get our resources together. And 100% of the profits are going to be going to midwives and doulas, Black and Indigenous midwives and doulas who are helping us and caring for us and giving us the love that we need.
Oh, I love that. That's so good. That's so good. So where can people buy the blankets? Like, where are they gonna be available?
Well, in during Black Maternal Health Week, the or a little bit before Black Maternal Health Week, the site will go live. You could go to my Instagram and you'll definitely see ways to find it there.
Okay.
Um, yeah,
Yeah, and what we'll do
and
is
they're
we'll
just
try to
50
air
this first round, so
I mean, you'll probably get orders for 1,000, and then you're gonna have to be making all these blankets,
oh my gosh,
right?
from your mouth to God's ears. I'm telling you, well, it's really I'm doing it myself, like the investment is mine. So I have to I'm a very small business owner. I have to do it in,
And I
kind of
got
a
it. You have to
format that I
I
can
got it, I
handle.
got it.
Yeah.
What's a great idea? I mean, it's just seem blankets are important, right? And they're very therapeutic and they can mean a whole lot. So it's very innovative, right? It's innovative and it means something. So I love that. So this was
Yeah.
such a great conversation. I mean, I love hearing about your journey. I mean, I've known you for all these wonderful things. You're an actress. I mean, you've been on Broadway. Like you're a big deal. And then now you're being used in this space to, speak into the lives of women who look like you, right? And I guess, do you think any of the, your past experiences with the acting and everything that you've done in your professional space has like aided or and enhance anything that you're doing now as an advocate in this space?
Absolutely. Absolutely. When I was thinking about when I was writing, I wrote that op-ed because I needed to get it out. I didn't
Mm,
even know who I was gonna give it, what publication I was gonna give it to. But while I was writing it, you know, taking care of my babies, talking to my husband, I'm like, I have been acting, singing, dancing for people, making people laugh, making people cry since I was a little girl.
mm.
This time they chose the wrong one. That's really what it is.
Yeah, that part.
If I have any uh, if I have any platform or any way to address this, I feel like God doesn't do things on accident, and
No.
I just couldn't let it. I can't let it stand. It was
Mhm.
one thing for it to just be us, but when I started to go out into the world and really and talk to people and realize that there are so many with the same story.
Mm.
Look, you're making my Long Island accent come out. I just said story.
So I
That's
heard
you.
it.
No, no, then it must be there must be some purpose here. I can't be quiet.
Yeah,
So I definitely think it's all, you
it's
know.
all worked together for the greater
Yeah,
good. Yeah,
yeah.
that's so good,
And I
that's so good.
really and I do and I believe we can really I really believe we can switch it, we can
Of
shift it.
course we
I don't
can
want any of my little sisters, I don't want anybody coming up to have to
have
endure
to
that. That
experience
time
that,
is
and there's no
done.
reason why we should. I mean, we are in 2024, we have, all these innovative ways that we can, like, tap into technology and
That's
what's in
right.
the available in the healthcare space. Like, there's really no need for this to be happening other than people have to get to a place where humanity is front and center and we
That's right.
all get treated the same,
That's
regardless of what our socioeconomic status is, regardless of, where we are in life. Like, we're humans at the end of the day, and we all deserve health equity, and
that's
we
right.
have to make that happen for ourselves.
Yes.
So good
Absolutely.
stuff. Good stuff. Well, listen, thank you for being here on Maternal. If folks want to learn more about Maternal, they can go to maternal.info. And then, Tatyana, where can people connect with you?
People can connect with me on my Instagram. It's at Tatyana, so A, and then another A, Ali, Tatyana Ali.
Awesome. Well, you're listening to Maternal on iHeartRadio. I am Kenya Gibson here with the beautiful Tatyana Ali. And until next time.
Kenya, thank you.
All right. Well, thank you.